Hi there, my name is Mandy and today I'm going to be teaching you how to self-administer an insulin injection. So first what we'll need to do is we'll need to gather our equipment. You will need your at-home glucometer, your lancet with the needle to puncture, glucometer test strips, several alcohol wipes, of course the insulin, and your insulin syringe. So first of all, it's important to check your blood sugar before you administer yourself insulin, because if you were to give yourself insulin and your blood sugar were at a dangerously low point already, then you could cause serious side effects like coma, seizures, death. We don't like those things. So be sure to always check your blood sugar first. What we'll do with that is we will prepare the glucometer by taking out a new test strip, inserting it into the spot in the glucometer, and that will automatically make it come on, and it'll start blinking a little red or a little gray blood drop, indicating that it's ready to accept your blood. You'll take the lancet, put it together. These are all different. Each one has its own style, and twist the tip to where the needle is ready. Take your alcohol wipe. Choose your preference, a finger. I'm not diabetic, so I fill this every time I do it, where some diabetics claim that they don't fill this. You'll kind of let it air dry. If you don't let it air dry, the alcohol can actually cause an increase in the blood glucose reading on your glucometer. So after it's dry, you'll take your lancet, you'll put it in. There's a button you push, it punctures it, it makes you bleed. You'll wipe off the first dose with the gauze pad. You'll take it, apply it to the end of your blood strip. Your glucometer will beep when it's accepted enough. Hold a little pressure there where you're bleeding. A few minutes later, it'll give you your blood sugar level. I'm not diabetic, so mine reads 60. So now you're done with that. We're going to assume that this thing read 140, just saying, because normal blood glucose levels are 60 to 100, and 140 is elevated. So that means that technically it's safe for me to give my insulin dose. What we'll do next with that is we'll move aside the things we don't need. You'll take another alcohol wipe. You'll wipe the top of your insulin bottle down. Kind of gently agitate your insulin. Set that aside while that's drying. Grab your insulin syringe. Again, since I'm not diabetic, we're going to pretend that my doctor's prescribed dose of insulin is 5 units. It's kind of a low dose, but like I said, I'm not diabetic. You'll take your insulin syringe, you'll invert your bottle, remove the cap, put it in upside down through the plunger, and draw up the amount of insulin that your doctor's prescribed for you. You do this by pulling back on the plunger. I always like to pull back just a little bit further than what I actually need. Check for air bubbles. If there's any air bubbles in there, you can kind of hold it all together, thump it, knock it up, and then I will push back the medication that I don't need into the bottle to the appropriate dose of 5 units. I don't know if you can see that. Those are kind of little numbers, but that's 5 units. You'll take it out. Set your insulin aside. Take another alcohol wipe. There are 4 spots that you can technically give yourself insulin. The best spot is technically in your abdomen, and you want it to be about 2 inches away from your belly button, anywhere around it. But for today's purposes, we're not going to use that spot. Other spots you can use are also the tops of your thighs and also your buttocks. If you use your legs, you have to make sure that you remember to kind of briefly exercise afterwards, because it's the slowest absorbing spot. For today's demonstration, we're going to be using my arm. What you want is you want the top portion, kind of the back part where it's kind of soft. You'll take that spot, prepare it with alcohol, just kind of clean it up. Take your insulin syringe, and you want this area to dry, because if you don't, it'll sting a little bit more than normal. I'm not diabetic, so I'm not going to be administering the insulin technically to myself, but I will show you every step of the way, pretending that I am giving my insulin. You'll take it off, you'll want to go at a 90-degree angle straight into your arm. You'll take the full length of that needle into your arm. And that makes sure that you get insulin into the appropriate spot beneath the skin layer. So you'll just take it, hold it, whatever's comfortable for you, to where you can also put your finger on the plunger. Just take it, you'll go straight in. We're going to pretend that's actually in my arm right now. And then you'll press the plunger. You'll pull straight out. They have safety guards on them. You push that right back up. That way you don't accidentally poke yourself. And then some people, if you bleed a little bit, you can kind of wipe it back off with the gauze or alcohol pad. And that is all that it really takes to give yourself an injection of insulin. If you have any further questions, you can also research more on the American Diabetic Association's website, and that is www.diabetes.org. Thank you.